Good evening, good afternoon, and good morning to everyone logging in from across the world. Thank you for joining today's webinar, Chat for Change, advocating for citywide inclusive and resilient access to safe and affordable water. This webinar is organized as part of a three-part series under Accelerating Access Coalition Initiative's Nudge Learning Lab, which consists of 9 webinars spread over the upcoming months. This webinar aims to discuss about the challenges and opportunities of safe and equitable water services provisioning in the context of rapidly growing Indian cities. We have with us a diverse group of experts from across the world who will share their experience and perspectives on some of the important and relevant topics on water resilience, inclusivity, safety, and affordability. Before I introduce the speakers, let me share a few housekeeping rules. If you have any questions to ask, please type it in the Q&A tab and not in the chat box. Please do indicate the speaker if you want any specific answer for your question. If you would like to introduce yourself or comment on anything, please do so in the chat tab. We will launch some poll questions in between the program, so please participate. It will give us some live insights from our panelists. Thank you, and let me introduce the speakers in the order of the program agenda. Our keynote speaker is Aniruddha Dasgupta, who is the Global Director of WRI Ross Center for Sustainable Cities. Ani leads the program's team of global experts in sustainable transport, urban development, and building efficiency, as well as its engagement across low carbon energy, governance, water risks, and associated areas. He also serves as a member of the WRI's global management team, helping to shape the institute's overall strategy and growth. Next up is Victoria A. Beard. She is a professor and associate dean of research initiatives in the College of Architecture, Art, and Planning at Cornell University and a fellow at the World Resources Institute in Washington, D.C. She has extensive experience in urban research and planning, informal settlements, and community-based planning in the global South cities. Welcome, Victoria. Next is Mr. Abhijit Kaplish. He is the Commissioner of Abohar City in Punjab. He has rich experience in urban and rural development. He is currently working in repairing and refurbishing the sewerage and water supply system of Abohar, Punjab. He has worked as an assistant secretary to the Government of India, Department of Health, and is a mechanical engineer with a background in law. Welcome, sir. Let's welcome Mr. Vishwanath. He is currently an advisor at the Biome Environmental Trust and a visiting faculty at Azim Premji University. He has more than 3 decades of experience in water and sanitation, ranging from designing rainwater harvesting and wastewater recycling systems to working on policy issues. He has authored a weekly column for the Waterwise for the Hindu newspaper. Next in the panel is Rajesh Rangarajan. He is the Regional Manager South in WRI-India, where he oversees the implementation of water and wash projects in rural Andhra Pradesh, urban Hyderabad, and parts of Kerala and Karnataka. He is highly experienced in the environmental sector, policy research and advocacy, energy efficiency, climate change adaptation, waste management, and WASH. The final speaker in the panel is Karaoke Inugo. He is the director of WASH Sector Support for Water and Sanitation for the Urban Poor, a global organization that helps transform cities to benefit millions without access to water and sanitation. He is an active influencer in the global WASH community with extensive expertise in building strategic partnerships between public, private, and civil society. A warm welcome to all the speakers and to the audience. The session will be moderated by Samrat Pasak, who is the Director of Urban Water in WRI India, and myself, Sindhuja Janakiraman, currently a project associate in the Urban Water team for WRI India. Uh, Before we begin with our presentations and talks, I would like to launch the first poll question. You will have 45 seconds to respond, so kindly do so. Okay, we have interesting set of questions, replies. Let me share the result. Okay, maybe we can touch upon this question later in the discussion. It could help the panelist in some way. Thank you. May I now request Mr. Aniruddha Dasgupta to please share your keynote speech?
Hi, everyone. Good morning and good afternoon, everyone. Thank you very much, Sandhuja and Samrat, for including me. First of all, I would apologize if you hear a banging noise. It's not your system. It's actually literally someone is basically doing a huge construction outside my house. There's nothing I can do about it. So bear with me. I hope you can hear me. I'm so pleased to be part of this. This is such an important discussion, and you will hear from Victoria the work we have done in the past. I just want to start by saying this particular year that we are in the middle of this pandemic. We are all middle of it. We read about it, and there's been a lot of discussion about pandemic. And one of the most interesting things that I've been reading about pundits across the world talking about whether, the cities will survive this pandemic, that people will leave cities and go away. Because that's something where I live, it's been a very much of a discussion. History actually teaches that would not be the case. Most probably history will repeat itself. Every time there has been a pandemic, actually, human race and cities, actually people who lead cities have reinvented cities. When cholera epidemic started, that actually started the movement of sewerage, underground sewer and sanitation. That has defined how cities are built today. Then the next pandemic that took place actually created standards for ventilation in cities. So pandemics actually reshape cities and make them better. It's a very terrible moment. The question for us today is what will we do, our generation? How will we make it better? Cities, I think, will live and thrive in the future, but the question is how are we going to make it better and learn from this? One of the things that has been striking to me and my colleagues who work on cities is how the pandemic has impacted cities. It's a very urban-centric pandemic. More than 70% of the incidence of the disease and the economic fallout of urban center. So that has been striking, but that, sure, it's obvious to you, most of you listening, most probably live in cities and cities all around you. But two other things have been very striking of this particular pandemic. One, that it has been immensely disproportionately impacted poor people in cities. Everywhere, not in poor countries, everywhere, in rich countries, poor countries, poor people are worse off. They are more sick, more people are dying, and also the economic fallout from the pandemic affects poor people much more. The second thing that is striking, that the fact that this impact has happened, any studies that people have done, had shown it's not because they're simply economically poor. Because they live in a system, in a city, that has very unequal access to services like healthcare. That has created multiple years of vulnerability in communities. So when it comes, a pandemic comes, it hits poor people much worse. It also has created cities when people are dependent on public transport. They can't actually get to work if the public transport doesn't work. So it has impacted poor communities differently. But what is other interesting thing that we have learned is that when poor communities get impacted and they're unable to participate in the workforce, in the country I live in the United States, there is a euphemism that is used, essential workers. Basically, pretty much everyone who runs the city, people who drive buses, people who serve food, people who clean the city, people who run systems that run cities. When they don't participate in the system and they don't get to go to work or they're sick, the whole city doesn't work. This correlation, this is something we knew all the time, I think. People who study cities know this, that how important it is that not only the lower income population cities, which is vast in a lot of cities, vast meaning more than 50% in some cities, if they don't have access to services and they don't actually unable to participate in cities actually don't work. This is true, can't be more vivid in what has happened in the access to water supply, during this time. One of the big things that was, if you remember in the beginning, the WHO said, please wash your hands. That is one of the biggest steps you can take to protect yourself and your families from the pandemic. If you don't have access to water supply, that is really not possible. They said, please distance yourself. If you're living 10 people to a 10 square meter, you can't distance yourself. You have to be safe when you travel to work or school or anything. If you have to depend on public transport that is crowded, you can't. So these systems that is required, that is absolutely critical for it to work, actually doesn't let the city work, and shows us how these basic services are critical, and water supply specifically. You will hear there are many experts after me who are much better more knowledgeable than me about details of access in the city. I want to focus your attention to what happens to the city if large portion of the population don't have access to water, housing, or access to transport. I just want to point out that this lack of access is the way we are actually building cities. This is not limited to few cities in the world. We are actually continuously building cities that are making this more and more unequal. The access to core services like water, sanitation, transport, air quality are actually becoming worse the way we are building cities. So the question is that we actually have to collectively think about how do we build cities differently. And don't think this is just about it's new or this just happened because of the pandemic. I think this is true for most things that we are facing. Take climate change that is we are facing. One thing I want to point out is the climate change. Our studies have shown, and I hope someone will share this with you, that there'll be 200 plus cities in the world that will be water scarce, just like Cape Town was 2 years back. And that is because of scarcity of water, how we're building cities, also lack of water because of climate change. And scarcity leads to expense, and poor actually suffer the most when the water is scarce. So what we need to do is not only just think about how to get water to the poor, but actually think about how to make sure the limited water is distributed among the various users in a equitable way, in a just way. And it's made affordable for poor people, because when you have less water, it'll get more expensive for everyone. So what we need is a whole systems approach. And that's why I think we need a coalition. We need policies, we need infrastructure, we need mindset change, we need governance structure that is fair. And that's why I can't be more excited about the approach you've taken to set up a real coalition, to bring people together from different places that actually can work together and solve, because it's a systems approach that we need. Just want to end by saying our work at the WRI Center that I work with 300 plus colleagues of mine is focused on how to help cities build a more equal, more just city from the service point of view. We work in 110 plus cities, and almost every city we work is scarce in resources and scarce in capacity. So the question is not what Copenhagen and London will do. I think they will figure out a good way out. The question is how will Nairobi do, Kinshasa do, what will cities in India do that have lower capacity, and solve these problems to figure out a way to provide services like water in a more equitable, more just, but more sustainable way in the long term. Thank you, Sindhuja. I'm looking forward to this conversation.
Thank you so much, Ani, for sharing an overview of how pandemic has affected the poor. May I now request Samrat to give an introduction on ACO initiative?
Thank you, Sindhuja. Thank you, Ani. Let me share my screen first. I hope everyone is able to see my screen, right?
Yes, Samrat, we can see it.
Yeah. Okay. Just give me 1 second. Yeah. I think Ani has already mentioned about why we need to look for some of the changes. Ani has given a global overview why the access to water, sanitation, hygiene is so important, especially in this COVID-19 pandemic context. I will touch upon some of the Indian context in a very brief, and where this ACO initiative is coming from. So if you are, you may be already aware of that India's urban population is expected to rise by 800 million by 2050, which is almost twice of today's urban population. And on top of that, in 2016, between 33 to 47% of urban population used to live in informal housing. And this is probably not very different even today. And on top of that, due to climate change and population growth, and there are other aspects also. Indian cities could face water scarcity in the range of two-thirds of what they used to have in 2015. And there are interviews happened in these informal settlements, which shows that they lack toilet, water, and drainage the most in such informal settlements. I think this is not a new statistics. I'm just re-emphasizing this with this context. Moving to the story of urban inequity, you can see, I mean, this could be any city in India. This is a photograph taken by me in Bangalore. You can see there are these well-housed apartment complexes which do have a lot of time 24/7 supply of water. But at the same time, there are these migrant workers or informal populations living just beside the apartment complexes and really don't have any supply of the water. They are on the mercy of some of the tankers who certain times just give them some of the water in kind, sort of a thing. And that takes me to the next point. There is a lack of reliable piped water supply, or let's not just put finger on the pipe, but lack of any form of reliable water supply. 43% of slum household lack this sort of drinking water within their household premise. Let's move on to the next. So it's not just there is a lack of water supply, but also the quality of water that residents of a city get. And most of the Indian cities, we do see while there are sewage treatment plants are coming up in the last 5 to 10 years, but still there is a huge supply demand gap from a sewage water treatment standpoint. While probably any city in India, if it generates around 1800, 1900 MLD of sewage, only say 300, 400 or 500 MLD of sewage, that is one-third, is getting treated. And rest of the sewage is actually discharged into the natural environment. And most of the disadvantaged communities or informal settlements, they take water from such natural environments. And that's why we see that 320 Indian children die every day because of waterborne diseases. It's a statistics bit old, but again, even today, it's not very different. We also need to think about the water scarce future. There are enough talks happening over the last 5 to 10 years that India is one of the highest risk water stressed country in the world. It's not just because we don't have a good monsoon, but it is also because of most of the monsoon water, they just flows away and really don't get much chance to recharge groundwater. And I'm sure Vishwanath sir is here. He can talk about this in quite a lot. Now coming to this vicious circle of the poverty. Now, if a community, if they don't have proper water, that leads to health and well-being impacts, that leads to vulnerable livelihood, that leads to the poverty. And this circle is kind of goes on and on and on. We really need to think of how to break this circle to bring these disadvantaged communities out of the poverty by providing them access to water, sanitation, and hygiene. And of course, Ani mentioned that the COVID-19 was a deadly reminder to talk about why inclusive access to wash matters for all of us. And it's not just we are talking, even Mr. Tata, Ratan Tata have talked about this. And he mentioned that we really cannot prosper in silos. We really need to look why inclusive development is so much important when we are providing this access to water, sanitation, and other basic services. So that's where the echo coming. The basic ambition that we have is very simple. Indian cities must aspire for citywide, inclusive, and resilient access to wash and healthy spaces. We'll discuss these specific words around inclusive and resilient access in the later part of the discussion. Then the next important thing is for all urban dwellers. That means we are leaving no one behind. This is required for the improved health and well-being, economic prosperity for all, and leading to resilient urban communities today and future. There are multiple priorities that we have taken under this initiative. It's a big coalition, and at our individual capacity, we are trying to add values or initiatives into this coalition. However, this specific nudge learning lab is coming as part of our overall capacity enhancement. Why that is required? Because addressing this sort of wash related challenges, a lot of time we have seen that these are too political for technical decision makers and too technical for political decision makers. And that's where we are trying to bring this learning lab so that there are some sort of a knowledge exchange. There are 3 formats for this learning lab: Chat4Change, masterclasses, and ideathon. Sindhu has already mentioned that there are total 9 webinars that are planned over the next months, 6 to 9 months. Today, we are discussing about this one, advocating for citywide, inclusive, and resilient access to safe and affordable water. If you really need any further information, please do visit the website for this initiative. Thank you, Sindhu.
Thank you so much, Samrat. Please do visit our website, and the link is on the chat. With no further delay, I kindly request Victoria to share her presentation.
Thank you, Sinju. Thank you for my colleagues at WRI for this opportunity to speak in this important panel on World Water Day. Thank you for organizing this. I'm in such admiration for your work for WRI-India. So I'm going to talk about a piece of work that I did while working with WRI on water and sanitation. I'm going to provide a bit of a global perspective on water. And so I want to back up and do a little bit of context setting about rapid urbanization and just the amount of people and the pace at which people are moving to cities. And when we look across cities in the global south, how 70% of residents lack one or more urban service. And we know that when residents lack services, particularly services like water that are so urgent and people can't live without, that people self-provide. And when people self-provide, they dig boreholes, they dig wells, they access unsafe surface water, that this creates all types of congestion, overuse, and inefficiencies. Sort of, again, backing out and looking at urbanization at the global scale, we know that urbanization is happening in different ways. We know that urbanization is happening most rapidly in middle-sized cities from 1 million to 5 million. We know that urbanization is not being accompanied by economic growth that has happened in the past. So we're seeing urbanization without this rise in GDP per capita. We're seeing an urbanization of poverty, and we're also seeing that urbanization is happening, and maybe most importantly, in cities that do not have the budget per capita to provide services. So I know in the discussion we'll come back to this, the different ways that we can attack.
Victoria, sorry for interrupting. We can't see your slides.
You can't see my slides?
No, you have to share your screen.
Oh, sorry.
Sorry.
No. Let me see. I should be fluent at this because I teach online, but I think it's too early in the morning. That's actually probably the good time to stop me. This is one of the most important slides. Ani really appreciates the slide because we collected this data in 30 cities. And what it shows is that cities don't have access to the budget per capita to provide core services. So as I was saying, the work that I'm going to present today is part of a larger body of work that WRI did, looking at access to all types of core services in cities in the Global South. And all of the reports, including the one I'm going to talk about today, is available for free online on the WRI website at citiesforall.org. But the motivation in this body of work for looking at water access was really it's kind of strange, it's kind of counterintuitive, this reporting on the Millennial Development Goals that we had done so well, right? So you look at this blue line, you look at the purple line and you see that, wow, a lot of people say we reached our Millennium Development Goals in terms of water access. But myself and my colleagues, the team I worked with at WRI, we really felt intuitively and really almost intuitively that there was something wrong with this data, that this really didn't represent the reality that we saw working in cities in the Global South. So this led us to look more carefully at how these different types of water access have been defined by the Joint Monitoring Program. And what we found is that the way that water access is defined actually obscures the reality in cities. It doesn't give us the full picture because safely managed water is such a broad category that it really says nothing about intermittency as well as affordability. And we know that intermittent water affects water quality. So I can go through this kind of quickly, but in my own mind, from my own work in cities in the Global South, this is the kind of, urbanization that I'm thinking about. And I'm saying, these JMP data, it really doesn't describe the realities of how I see people every day in cities. And I think this would represent my colleagues' work as well, obtaining water. And I know that we're not going to talk about this today, and you guys are going to have another webinar on this, but I just really want to say, not only how we obtain water, right, but how we dispose and ultimately treat water affects, of course, water quality. This is a picture of community-based sanitation, community-based septic tanks. So we decided, because there was a lack of a really good picture of water access at the city level, to collect water data in 5 cities in South Asia, 5 cities in Africa, and 5 cities in Latin America, really to get this picture. And what we saw, as we would expect, in some ways it just almost reiterates what we would expect or what we know, is that water access, particularly piped water access, is not keeping pace with population growth. So you see about 22% of the population in the cities we looked at in Africa having access to piped water, 63% having access in the South Asian cities to piped water, and 97% having access to piped water in Latin America. And I would just say that this level of access in Latin America, while super impressive, also obscures the reality that water is not available 24/7. And so we know, again, that having intermittent water allows for all types of contamination to enter into the system. This picture looks at water intermittency. So how many hours a day, average days per week, hours per day, water is available. The cities with the orange and the red and the yellow, the water is less available. And then how households treat water in those cities, knowing that there is this increased risk of contamination. So it's sort of a proxy for water quality. And so where households don't have access to piped water 24/7, 7 days a week, we know that they go to alternative sources, right? They go to informal vendors, they buy bottled water, in some cases sachet water, but more and more we're seeing people turning to tanker truck water, and tanker truck water is a very expensive way for households to obtain water and speaks to affordability. So tanker truck water in Mumbai, we found, was 52 times the cost of municipally treated piped water, just to give you an example. But in all cases, it was more expensive and the most expensive way, other than bottled water, to obtain water from alternative sources. Now there's this kind of rule of thumb that people use that water and sanitation services should be no more expensive than 3 to 5% of average household income per month. And what we see is that water, particularly the tanker truck water, the chart down below in the yellow, is in almost every case more than 3 to 5%. And this is just for water, not including the cost of dealing with household sanitation. This is kind of my last data slide, but it just shows that we see in many cities that people are relying more on surface water, and they're having to obtain water from further away. So they're going to more distant sources and moving water. And this is incredibly energy inefficient, and we know it increases water loss. So this is and I encourage you to read the report, at least the executive summary, maybe the highlights, but these are 3 really simple things that all cities should be thinking about to improve water access. And I'm sorry, they're really basic, but I feel that this is really, in some senses, almost a very physical problem. And there's no amount of fancy capacity building or technology or governance that's going to get away from the physical constraints of this problem. We need to extend the piped water network to every community and preferably to every dwelling and plot, regardless of land tenure status, to urban dwellers. Cities need to think about addressing water loss, or what, a fancy word, non-revenue water, by making metering universal and investing in improved maintenance of the infrastructure system. And finally, and the report goes into several strategies and innovations that cities are using to make water more affordable. Not only the initial connection, but the per unit cost of water, and then innovative things in terms of cross subsidies and targeting water subsidies within cities. We have good examples of this in Global South cities in the report, but also facilitating more flexible payment schemes to help people who are in the informal economy. So then you're probably sitting there, all your water experts are sitting there and go, yes, we know these things, but how do we do this, right? How do we actually do these 3 things? And I don't think there's any way around this. We need a different ethos about water. We have had decades of privatizing water and corporatizing water utilities. It has not significantly improved water access, particularly for the poor, the urban poor. We need to stop thinking about water as a commodity, and we need to invest in water and making universal access. And this is going to require, most cities will not have, as I showed you in the beginning, will not have the resources, the tariffs, the transfers, the taxes to do this. So we need subsidies from national government and international donors. And we need to think about nationally access to water as being a socially protective measure. So I'll just stop there. Thank you for my time.
Great. Thank you so much, Victoria. That was such an insightful presentation, and thank you for keeping time. So now I would quickly move on to launching another poll before we move to our next speaker. Yeah. What is the most pressing bureaucratic roadblock to realize the ambition of adequate clean water for all in cities? Unplanned urbanization seem to be taking the lead. Maybe we can, kind of collate all of these results in the discussion. And if anyone has any question for Victoria, please do share it in the Q&A tab, and we can pick it up during the Q&A session. Next, I would call upon Mr. Abhijit to kindly deliver his talk.
Hi, everyone. It's very nice to be here. And I think the theme of the ACO series really nails it when Samrat said that the political people like me don't know about the technology behind all of this, and the technocrats probably don't understand the politics as well. And water is a very political sort of issue. The experts here, we've seen only Victoria's presentation, but she's pretty much nailed it as far as the technical aspects are concerned. So what I will be giving you is I'm not an expert, but I know my city well. And as a case study, you can probably see it. And I hope it helps everyone understand the problems that there are. So I will share a screen. It's hardly a presentation, but whatever it is. Yeah, so are you seeing the, yeah, so can you see the presentation now?
Yes, sir. Yes, sir.
Okay, excellent. So first of all, I think symbolism, when we all look at water, what do we think about? And I lived in Chandigarh all my life, which is a developed city in India, and there was almost never water scarcity. So I think I looked at water in a slightly romantic way. You know, yesterday I was with somebody and they said, okay, whenever, you know, it starts raining, you start looking for some kind of snacks. You know, you look at, you think of water and you imagine the beach or something like that. You think about drinking water and you think about all the nice things that you can do with it. But it is when I started serving in these small cities in Punjab that I realized that that's not the way we look at water. Today, as an urban administrator, when it starts raining, for me, it is mayhem. And I have to look at it in a very, very different fashion. But here's how people look at water when they think about drinking water. There are 4 key themes that people will keep talking about again and again whenever they talk about water. Number 1 is cancer. Number 2 is the RO. Number 3 is the submersible that Victoria pointed out. Both of these, RO as tanker water, as we call it, and submersible as the water that you take out from the ground. So that's the local colloquial way in which you talk about it. And then Bisleri is a local brand, which supplies mineral water, as they call it. So cancer, I particularly wrote cancer because in Punjab, where I serve, there is a lot of paranoia about water and the health effects of water. And people, not just in urban areas, but also in rural areas, are really, really scared that water, which has pesticides in it, which has insecticides in it, which in some cases has uranium in it, arsenic in it, is definitely going to cause cancer. And the paranoia is so high that I've seen some people put 3 layers of RO systems in their houses so as to filter the water that they get. So as I said, the RO, while it is publicly supposed to be banned, but it is probably the most quintessential thing that you will see in almost any middle-class house in India. And almost everybody is filtering the water that they use through an RO system. There is an RO system even in my house. There is an RO system in the house of the engineers who are supposed to manage the entire system for the city. And those who can't afford RO systems will use submersible water through tankers, or in some cases, this submersible water will go into the RO water because the water in my city is really, really, really bad. So to talk about intermittent water, when I'd grown up, I'd seen intermittent water, meaning, you know, water coming twice a day. But here, water sometimes comes after a week, which means really nothing. The quality of water is very, very poor. So, I mean, it's it's as dark as, I like to say, it's as dark as a cola. You know, it's as dark as Coca-Cola or anything like that. And so, you know, the rich ones use this, which is Bisleri water. And there are these big 20-liter cans that we get, and everyone has these dispensers at home. The poor will use tanker water. The slightly middle class who are not used to the Bisleri water will use RO systems at home. And almost everybody is concerned about cancer. Now, the result of all of that is that while we are spending a lot of money per se on water, it's really quite a mess. Now, the reason for that I saw in this city is this sort of slide, which, I've called it big money and small commitment. Because what has happened is that over the years, India has gone through a very liberal policy, and we looked at privatization as sort of an answer to everything that we try to do. What happens with these big public-private contracts is that while a big amount of money is involved, a lot of money is pumped into infrastructure, into building water treatment plants, but there isn't really any sort of responsibility of the private partner, which in a lot of cases are big companies, of actually going through any service level agreements. A lip service is paid to most of these service level agreements. And what happens is that no penalization takes place. The private player is almost never liable for the lack of water to a very large number of citizens in the city. What he's mostly looked at as being liable for is actually infrastructure, which is irrelevant as far as water supply is concerned, as long as you can't really get the water to the last person. So what I'd like to emphasize here is that what we also need, like we've looked at a lot of really smart financing options in the sector of health. I think we also need very smart finance in the water sector, because till the time we can't reach a very sophisticated policy, which maybe awards people for supplying water through service level agreements to the last woman or man on the line, the last kid in the line, and actually if they can take advantage of that and maybe earn a bit of money out of that and be penalized if they're not able to do that, I think that would be a good use of the private sector. But what I've seen is right now, these are mostly contracts which are too big to fail. The companies make a lot of money out of this, these big pipelines, these big water treatment plants, fancy technologies. But at the end of the day, at least what my city is getting, despite being an Amrut town and spending almost, I think something close to 40 CR in the last like 3 or 4 years on water supply, what we really get is probably like, it's worse than anything that you can imagine. So people get water once in 3 or 4 days. The first 1 hour for about 40% of the population, for the first 1 hour, the water is black in color, and then they wait for it to clear out. Then they put it in their tankies, over at tanks at home, and then they supply it to their house. Of course, no one uses it to really drink water, and for drinking water, they rely on the above the submersible water, the bistleries, the RO systems, and so on. And they use this just maybe to water their plants, sometimes wash their cars, maybe for the sewerage system, so on and so forth. So that's how it happens. Now, I think a very, very big thing when we talk about, the private sector or the public sector actually going into these problems is, whenever we look at a water system in any city, we don't get to design greenfield cities, and whatever has happened before us has already happened. So no one really goes into, what was, and, you can only come to what is and what will be if you are able to study what was. The legacy is very, very big. There are areas which are doing well. There are areas which are not doing well. We are not in a habit of documentation. We don't really know where the problems really lie. And nobody has the technical expertise to go into what was. Now, none of these companies which are, bidding for these big money sort of contracts, none of them will go into what was, because they have no liability as far as the service level agreements are concerned. All they are concerned about is the infrastructure that they are to build. Now, a lot of times, because of sheer legacy and because of the sheer fact that you're trying to repair something which is really broken, what happens is that you can't solve it without actually kind of looking at what was. So if you'd like to call it in this way, if I may use an analogy from architecture, water supply cannot be like building a new building. It has to be like restoration architecture, because you really have to improve what was, because a lot of money has gone into it, and a lot of times you can't afford to really remove all of that and plant something new. Now, because we don't invest in all of this, so what will be is most certainly unknown. And because we are not relying on service level agreements, to really focus on what we are giving to people. So all of this is, I would call it a charade. I mean, I don't think there's any use to all of this. Now, coming back, I mean, of course, I have a bit of a I have a bit of a skewed way of looking at the private sector in that sense, because I'm a permanent bureaucrat. And I mean, I may think that the government is better at looking at it, but why I think governments may deal with public water supply better is because of feedback. In a democracy like India, we get really live feedback. People tell our politicians, people tell officers like me that there is a problem. Now we will hear this problem. It is my responsibility to solve this problem. A politician will get votes on the basis of these problems, and water is political. A private company looking into infrastructure building, looking into actually completion of contracts will not get into that. But again, it comes back to what we started from, which is the entire emphasis of the ACO initiative, which is technical know-how. I joined the city about 9 months ago, and the biggest sort of problem that I faced is that my technical team and the teams at the state headquarters, nobody had the technical know-how to actually deal with these problems. And because because the entire system is mostly being led by generalist bureaucrats or also generalist engineers who are not really focused on water management, what happens is that we are not able to solve these problems despite very solid feedback and also, I would say, very solid willpower. So if we could actually plug this, I think my way out of this is we should not look at big ticket investments. We should not look at these big PPP contracts. What we should look at is a public managed water supply system with solid feedback and solid technical know-how that institutes like WRI and others can actually contribute with. Thank you.
Great. Thank you so much, Abhijit sir. It was a very interesting presentation, and I'm sure that there are going to be a lot of questions coming your way later. So before we move on to the next speaker, I would like to launch another poll question. What is the best immediate low investment, high return opportunity to realize the ambition of adequate clean water for all in cities? Quite an interesting result, because adoption of IR was actually not leading in the beginning. Thank you so much. I'm going to stop sharing. May I now request Mr. Vishwanath to come forward with this presentation?
Done, Sindhuja. Is this visible now?
Yes, yes.
And I'll make it full screen?
Please do.
Yeah. There you are. Is that right?
It's still not full screen. Yes, it's perfect.
It is, yeah, okay. So time back. Thanks a lot. I think both the previous speakers have covered extensively all points. So I'll just sort of reiterate some of them, but also bring to fore some other points. So the 2 points that I want to focus on is the issue of citywide, inclusive and resilient. And I'll take it separately as I go along. From a resilience perspective, I think Indian cities and urban areas still do not have a compact with the river basin that they occupy. So allocation of water for agricultural use, industrial use, and urban use is not firmly set on the platter. Cities are not aware of how much water they're likely to get from a river basin. They merely draw it based on the projected demand within themselves. So somewhere along the line, if we want to build water resilience, we'll have to recognize that urban areas also are growing rapidly. Our economic powerhouses have a lot of poor people within them. And therefore, allocations will need to make sure that the first priority for water, which is drinking water, goes to rural areas for drinking purpose and for urban areas for drinking and domestic purpose. So resilience can easily be built with basin level planning and basin level thinking. Unfortunately, we also don't have institutions at river basin levels. We need to get those river basin institutions working quickly. Agriculture continues to remain the dominant consumer of water. Some water can definitely be released from agriculture to come to urban areas without any problem. And while we think about the river basin at the larger scale and build resilience and build surety for water, sustainable water for cities to consume for domestic and drinking purpose, we must also look at focusing on local waters. These two go in parallel. So the revival of surface water bodies within cities is crucial to build resilience, but also to provide for the poor, because it's a lot of the poor get access from groundwater, and revival of surface water bodies replenishes that groundwater. In addition to replenishing groundwater through surface water body restoration, the recharge program, which the Prime Minister launched today, which is catch the rain for the next so many days to make sure that the monsoon is captured, needs to be addressed very thoroughly, systematically, and structurally, and we should build these recharge, understand our local aquifers, and build a link between rainfall and the local, especially the shallow unconfined aquifer. Make sure that we top it up, because cities are crusting and prohibiting the percolation of water into our aquifers. We should try and increase that. And in the process, build agency for the people who do this recharge. So in Bangalore, for example, it's the traditional well digging community which does this kind of work. We've set ourselves a goal informally as 1 million recharge wells. Those 1 million recharge wells will help provide the city with 1,400 million liters of water per day if and when they are completed. But in the process, they will have provided livelihoods to about 750 families of well diggers. So creating agency for those who are poor, who are coming from a traditional community, as we build resilience, will be a good strategy for many urban areas in India. Similarly, wastewater, which Samrat also pointed out, is not being seen as a resource, can be a potent argument to invest in from a livelihoods perspective. What we found in Bangalore is where they're working well, they're able to replenish lakes, treated wastewater, they're able to replenish lakes. And as in the famous case of the East Kolkata wetlands, they're able to ensure livelihoods for fishing and in the process encourage bird biodiversity. So both livelihoods, social consequences of it, as well as ecological consequences can be addressed if treated wastewater and surface water bodies are linked, right? Wastewater is also increasingly being linked to the hinterland. Sometimes cities do a protracted navel gazing. They don't bother about the hinterland so much. But treated wastewater, like the city is doing, the city of Bangalore is doing, can be sent to the hinterland to fill up lakes, to recharge aquifers, and to provide farmers who are facing the brunt of drought and climate change with enough waters to grow food and get a livelihood themselves. In the process, what farmers do is to put pressure on the system to A, collect as much sewage water as possible, B, treat it adequately for it to come to them so that it doesn't pollute their water bodies, but provides them the water for fishing and for farming. In the process, food security for the city is also ensured. So compacts between the hinterland and the cities will have to be reimagined and redrawn and can be worked upon very quickly, both from an informal and a formal perspective. Within cities, exemplars will have to stand out, like this apartment, which picks all the rainwater and recharges it into the ground, every drop of rainwater, but takes wastewater and treats it to such quality that it can drink it. And actually it blends it with groundwater and drinks it, being one of the first apartments in the whole of India to do this, right? So they have been able to overcome the yuck factor, but they've also been able to demonstrate the trust in technology and replace pure water. These kind of examples will need to be quickly replicated and scaled up as things go along. Victoria already mentioned it. The basics need focusing. We need to meter every connection. Volumetric pricing has to be there, but all within the framework of human right. A certain minimum free or very subsidized, but beyond that, water has to be metered, has to be priced for the institution which supplies water to be financially stable. Unless the institution, whether it be the local body or a parastatal, if that institution is not financially stable, it cannot invest in maintenance. So you will have leaking pipes. It cannot invest in capital infrastructure. So it will not be able to expand its services to the peri-urban. And it cannot create a sinking fund to replace all this infrastructure when their life is over, right? So we must look at the financial sustainability of the parastatals there. And there are other methods like rainwater harvesting, which can spur individuals getting and individual buildings getting involved as part of the solution, where rooftop rainwater is captured and either stored or recharged into the ground to supplement the city's water requirements, right? So this needs to be done. And again, these basic service level indicators, as Abhijit has already pointed out, these outcome indicators should be our focus, not physical investment in infrastructure. And they are all there with us for the last 15 years or 12 years. We need to bring them into the negotiating table, bring it into the narrative, and keep measuring this at all times and make a transparent display of these measures to our citizenry in all our urban areas so they know what is happening. For example, with non-revenue water, customer complaints, functioning metering or not, all these need to be there. And very specifically, coverage of water supply connections in slum settlements. We have to run a pro-poor policy where we assure the poor of a connection which is free of cost. Connection is the biggest barrier for the poor to access pipe water supply. That barrier should be overcome, including the legal barrier of tenure rights. If the financial and legal barrier is overcome, then the poor have access to pipe water supply, then get a tap in their home. Then the pressure can be put on the system to make sure that the pipe delivers water and it's of good quality. So that measure has to happen. So bylaws and regulations have to work. I don't want to repeat this, but there are many number of bylaws which require, for example, automatic switch-off pumps in multi-storied apartments, metering in every flat in every apartment. This is the level of metering that we need to go, not just individual buildings or individual apartments, but every flat, right? The inclusiveness component, for long we have taken data and ratcheted it up like MDGs or SDGs. It seems to drift up to the state and then up to the national governments and to international bodies. Data should drive itself into ward committees and ward sabhas, where data, for example, universal connection, or how many households are there in a ward, how many of them are connected, and how many of them are connected to water supply, and how many of them connected to sanitation, and what is the goal to get universal connection. This kind of data, which decentralizes itself and reports to the local and strengthens the local politician and the local engineer and the local community, is very much necessary, because universal connections and monitoring can only happen at a local level. It cannot happen at state or any higher levels. And pro-poor policy has to be focused, which is the barrier to the poor to access pipe water supply and pipe sanitation network. Those have to be overcome through a defined pro-poor policy, right? And finally, if we want to make things sustainable, we'll have to look at it from the lens of what I call the stifle model: social, technical, institutional, financial, legal, and environmental. These 6 lenses will have to make the invisible visible, bring issues on the table for discussion constantly, reminded constantly, and then we work on solutions for our cities. The first glimmers of hope is emerging. We're right now at the Kuznets curve point where we are starting to invest heavily into water infrastructure. This is the moment to seize it, make it open, transparent, and democratic, and then we will see results in the coming 5 years. Thank you very much.
Great. Thank you so much, Vishwanath sir, especially the stifle model. It's very interesting, and we will pick it up again in the discussion. Now, may I request Rajesh Rangarajan to come up with this presentation, please?
Yes, sure. Is it visible now?
Yes. Could you make it full screen, please? Perfect.
Okay. All right. Hi, everyone. Thanks, Samrat Sindhu. Glad to be part of this panel. Unlike many of the other speakers, I'm going to bring a perspective that is largely experiential and from, very hard-nosed implementation and challenges that come with implementation. I'll broadly, categorize my presentation into 3 parts. One is a basic introduction for what we do as WaterAid. The second part would be to outline some of the interventions that we do in water provisioning. And lastly, basically talk about the kind of insights and challenges that we have seen, and what are the kinds of solutions that we perceive as potential ways of improving access, right? So WRI-India's been around for about 30 odd years now, and our mission has been to provide safe water, decent toilets, and hygiene for everyone, everywhere, aligning with the SDG goals. And it's an international non-profit. In India, we separately registered as Jal Seva Charitable Foundation, but we use the global WRI brand as part of our collective work across the globe on water issues. Thematically, we focused on 4 broad areas: improving access to drinking water, water and sanitation hygiene institutions, which is basically schools, Anganwadi centers, and healthcare facilities, which are essential agencies within the community that support welfare and development. Inclusive sanitation, especially in areas where we work in water, we automatically work on sanitation as well. And we do a lot of work around hygiene promotion, hygiene behavior change, on menstrual hygiene management, and so on. So these are our thematic areas. And what I'm going to talk about is primarily stemming from the experience in Hyderabad, where we are based out of, and we've been working over a decade in providing water access. This will also be similar to, I think, several of the urban centers that WRI works in across India. So this is just a snapshot of a large urban city and the kind of experience that we have been getting over the last decade. And primarily we work in slums, particularly non-notified slums where service provisioning is pretty poor. And this is the sort of very broad statistics that you can see from Hyderabad in terms of the amount of slums that are there. We're looking at about 1,400 odd slums, 17 lakh slum dwellers, 335 non-notified slums, essentially slums which don't really have any service provisioning simply because they're not notified. And 1/3 of the population in Hyderabad lives in slums, which is a very striking figure. And just below that, you would see that Hyderabad has the second largest poor population in India after Mumbai. And growth of the city, just like other cities, the story is very similar. It's fairly, disproportionate, highly polarized in the way it's developing. And there have, of course, been all these alarmist reports about Hyderabad running out of water, groundwater by 2020 and so on. So this is the stark picture that we're looking at. And I think this is fairly common across many cities. We've worked across the city over a particularly intense period of the last 3 years. Prior to that, we've been working in different pockets. We've been able to consolidate the work over the last 3 years and improve our provisioning of water and sanitation. And I think was talking about feedback, and that's something that we wanted to create in the very beginning, wherever we intervene, where we aim to empower the citizens through a platform called the Basti Vikas Manch or the Slum Development Federation, which really is the feedback mechanism to the government, because we know that last mile delivery is not possible and gaps will still exist despite the kind of investment that goes into infrastructure. And it is these Slum Development Federation platforms that actually give feedback to the urban local bodies, to the water agencies, that various problems exist in water supply. And this is also an important platform for us as WRI to work with the community, take ownership, where community can take ownership, and we are able to provide water hardware and related services through this platform. There have been several representations that these slum development federations are able to provide to ascertain their wash rights, act like the eyes, ears, and hands to some extent of the community in order to extend these services and demand what is due to them. And to give you a snapshot of the work we do, we do very hardcore infrastructure ranging from roof water harvesting to repairing pipeline networks, stand posts, etc., on reviving abandoned bore wells, on restoring pipelines, and an important subject that we look at is also water quality testing. And not many people touched on it, but this is something that we are finding increasingly problematic as cities expand. We also do a lot of work on toilet access, where we restore toilets, because we find that, like I said, Where there are gaps in water, there are spontaneously gaps in sanitation, and both of them coexist. There's a lot of restoration work we do, and we also provide women-friendly, gender-friendly toilets and child-friendly toilets in wherever we do water provision. And there's a lot of hygiene promotion work we also do as well. This is just a snapshot of it. And with COVID-19, some of this work has actually become more paramount for us as we enter into communities, as we sustain our work with communities. And an important aspect that I want to talk about is the amount of time we spend on operations and maintenance. And this is something that we've been able to do successfully, even with very minimal funds, by actually getting contribution from the community, from the institutions. And this has actually helped us sustain and shown that big money is not necessary for operations and maintenance and sustaining water hardware, but just community contribution would actually help in going a long way to strengthen operations and maintenance systems. We also do a lot of outreach. I'll just skip this part. So what are the key issues that we are actually experiencing from our water service delivery experience? Like many of speakers have already alluded to, in Hyderabad, for instance, there are multiple schemes at play. There are at least 5 schemes that I'm aware of which provide water to several parts of the city, and yet there are challenges that remain in delivering even at least the 55 LPCD. So like I said before, last mile delivery challenges persist. Even within slums, we see one house getting it and tail end connections not working, and therefore basic water requirements are not met. There is this whole service provider and customer relationship that's leading to a lack of community participation in water. And the reason for us to create these community institutions is to primarily encourage community participation in water supply. And at that decentralized level, we find that it's far more beneficial to ensure that there is equitable supply of water. And increasingly, even urban consumers, low-income settlements, seem to be stepping back and saying that we are customers and we don't necessarily need to participate. It is a job of the government to provide water to us. So this sort of a transition is something that we're seeing, and we're trying to sort of recalibrate this to get more community to participate. There is the rhetoric of conservation that happens time and time again with very limited action on the ground. Vishwanath was talking about the kind of bylaws that exist. It's the same in Hyderabad as well. There are several public-facing campaigns that have happened, merely on awareness generation and some penal action, but there's been no systemic push for water conservation or alleviating water wastage or even harnessing rainwater. And we will see this kicking in, approximately in this quarter of the year, every year before June, when the monsoon starts. We'll see campaigns, but we will not be able to see any action on the ground on rainwater harvesting, for instance. And the other thing that we've noticed is that in institutions that we work in, schools, Anganwadis, and healthcare facilities, there is no clear budgetary provisions to sustain water infrastructure. We've been able to provide this at some level. Schools have been able to contribute, community has been able to contribute, but if we have to continue to sustain very meager budgetary allocation of 10,000 to 50,000 a year per institution, which is basically untied funds, is simply not enough to maintain the kind of infrastructure that is necessary to supply water to the doorstep. So therefore, what are the key questions that we see that needs to be answered if you have to look at urban and resilient water supply, particularly for low-income communities and formal settlements? So our first, I would say the first thing to look at is how to improve the last mile delivery. And there are, we've been at Taps and Toilets organization, and we've been doing this time and time again. But we've just not been able to find ways to actually scale this up. And this is something that we find challenging to do. Secondly, increasing community participation. And while we have several such models of community-based organizations engaging in water service provisioning, we're not able to see the sustained community participation that is required in order to work with the government collaboratively and solve the kind of, not only just day-to-day problems on water service provisioning, but also the long-term issues of supply and particularly the lack of storage that is evident in many of the areas that we work. Practically because settlements have not been planned well and there's no space for storage, and others because simply the government thinks that storage is something the community needs to take care of. So these are some of the broad questions that, from the top of my head, I'm able to share. In terms of what we see from our experience as potential ways of, that could be solutions as we move forward in providing resilient water supply, is, water aid works with excluded and marginalized communities. And we continue to identify and focus on such needy geographies because this disparity is growing in cities. And so where there is no water, we need to focus our efforts on those areas. And we should also saturate efforts towards access. There are multiple actors who are working in a city, and there needs to be some level of top-level collaboration where we work towards providing access, saturating efforts in geographies, particularly in slums where there are, and other informal settlements where there's absolutely no access. Working with communities becomes paramount. Whatever the kind of reforms that we bring, without the involvement of communities and a cross section of the community, we will be unable to provide the kind of service standards that we want. Technical support, we found that there are several designs and standards that are there, and water aid has its own set of standards. And this is something that we constantly share in order to build capacity. And these are all very, low tech, very easy to implement, and community can easily own and manage this in a highly decentralized manner. And as part of that, this is part of our work on building capacity of grassroots organizations and supporting decentralized government in its own work on delivering on the water promise. We also embrace a lot of innovations. We found they are now just flooding the market, be it water quality or just in terms of technology and increased access. We try to embrace these innovations and we try to implement them as much as possible, and we ensure that these are replicable and easily owned and maintained by the community. And lastly, there is
Rajesh, sorry to interrupt you, but we are short on time. Please wrap up.
This is my last point. So there's one set of people who we leave out in all this conversation is women and youth. So we play a particularly specific role on identifying the social capital, build this skill as grassroots technocrats, provide them skills in income generation, including water quality testing and plumbing services, which again adds to the overall operational maintenance angle that I was talking about. I'll leave it here. That's it for now. Of course, there's working with government and all of that we do, but thanks.
Thank you so much, Rajesh. With no further delay, may I request Karaoke Mugo to share his presentation, please?
Yeah, thank you very much. Are you able to see my screen?
Not yet.
Okay, just a sec.
Yes.
Okay.
If you can put it in presentation mode, please. Yeah.
Sure. Yeah, thank you very much. My presentation is basically a little bit on, sorry. Just remove this. Thank you. Yeah, my presentation is a little bit on a general concept on how cities can improve their water supply by simply adopting non-sewer sanitation approaches. Very generalist conversation, and hope you enjoy it. We all know the challenges that we are all facing in cities, and in the next 30 years or so, our urban population might even double. So we need to be more conscious of how we supply water to the urban dwellers, and especially low-income people. So what it calls for is that we need to think about supply systems that are sustainable, that are less costly, and that don't put too much pressure on our environment. Yeah, maybe I'd like to talk about why cities have problems in supplying water to their people. And the first one is that they don't plan well, and neither do they adapt. So they start out with the obvious sources, getting water from rivers, lakes, and possibly going to underground water sources. And we've had a lot of that in the previous presentations. And then as the demand for water grows, people keep on expanding those systems to abstract more. And as the populations grow, there's greater water demand for food and other services that also require water. So there's great competition between drinking water and other uses of water in urban areas. So that keeps on stressing the water sources and the environment to a point whereby possibly it becomes very difficult to supply water for cities in the traditional sources. The second thing is about the unreliability of the supply system from the plant to the wastewater treatment plant, that continuum. You have a lot of non-revenue water. We grapple with that a lot in the sector, both commercial and physical. And then we also have a lot of losses that we have across the city in supplying water, and also in terms of taking it to the sewer treatment plants. And the third thing is about how we use water, especially in waste removal from the city. We normally go for centralized sewer systems that are heavily water dependent, and I'll talk more about that. But also it's important to think about when you bring in water into the city, we always need to ask ourselves how much of that ends up at the wastewater treatment plant. And ideally that is a ratio of 1-to-1. So whatever we produce somehow needs to get back to the wastewater treatment plant. So the stress is not just about supplying water for drinking. When you increase supply of water, you also increase the amount of waste generated. So you also increase the pressure to remove it and get it treated. What happens is that cities go for the very obvious kind of steps. And the first one is, they exhaust their local groundwater and surface water. That is what happens. So a city will start off, and most of them start off near water sources, lakes, rivers, and other sources. So that once they exploit that to the last drop, then they move to groundwater sources. And then after that is depleted, they import water from other basins, neighboring basins. Some cities even go beyond and import water from other countries, far away basins. That's usually the second step when they can't cope with water stress. And the final one is when now they are lost for choices and they decide to go for recycling of wastewater and treating stormwater or desalination. And we've seen a lot of that happening in the recent past. But what is surprising is that if cities would go for water conservation, that is one of the cheapest ways of increasing access. And this is a study that was done in San Diego a while back, and it showed that actually urban water conservation is one of the cheapest ways of increasing access to water in any given city. I would like to talk a little bit about Nairobi, a city where I live in, currently with about 5 million people, with very little water supply, and is growing rapidly. So the stress to provide more water is actually very high, and possibly it will not be able to cope with the population growth. And in Nairobi, we still have another big challenge of waste disposal. 66% of our waste right now is not treated, meaning that in future, this percentage is likely to increase as the population grows. And the most likely scenario is that we respond by investing in wet sewer infrastructure. So more demand for water. Right now, we can't cope with our water demand, but in terms of waste removal, we are likely to cope with increased sewer infrastructure. But in Nairobi, we have a social enterprise called Sanitation, which I wanted to kind of talk about. And they are doing a non-seaward kind of sanitation model whereby they build toilets, lease them out, and people pay through subscription. They collect waste from households, transport it, and treat it and convert it into fertilizer and fuel. They are currently building the largest organics factory in sub-Saharan Africa. So quite an interesting business that is doing well. Currently serving about 100,000 people per day. And that is a huge number, and it's continuing to grow. And I wanted to discuss that in terms of how such kind of businesses that don't use wet infrastructure to remove waste can be able to serve to save water in a city and unlock it for those who don't have. If you look at how, I won't go into the basics, but ideally somebody needs about 80 liters of water to flush a toilet per day, having produced like 2 kilos of waste in a day, both fecal and urine. And Sana just serving 100,000 people means it saves around 8 million liters a day. And in the context of Nairobi, we have a water demand of 830 million liters a day, and 500 million liters a day is what we can produce. And what Sana just saves in terms of dry sanitation is actually 1% of water demand and 1.6% of water produced. What I'm trying to say is if you had like 5 of these, 1% looks very small, or 1.6 still doesn't look big enough. But if you have 5 such businesses in a city, ideally, you're talking about 5% of water savings, or maybe close to 10% of water savings. That is huge. If you looked at other forms of saving water or conserving water, like non-revenue water reduction, a utility that brings down its water losses by 5% will have done a lot of work. So this is another way of looking at how we can be able to conserve water in cities. And for us, I work in WhatsApp. I think we are very, what can I say? We are very intentional in promoting sanitation businesses as part of the city solution. And also we are among organizations that are encouraging others to embrace citywide inclusive sanitation that looks at other options of sanitation other than centralized systems. So I think we need to start thinking differently, especially in planning waste removal, and especially when it comes to sanitation, that we need to provide our city residents with other options of waste removal other than thinking about the costly waste systems that also end up stressing our water sources. I think I need to stop there, and thank you very much.
Great. Thank you so much, Karaoke, for this informative presentation. I think with this, we can immediately move on to the discussion session. So Samrat, may I request you to take over?
Thank you, Sindhuja. Thanks all the panelists. Okay, there is a poll, I guess, right?
Yes. Can we just quickly answer this poll? I think we can continue, Samrat.
Yeah. Thanks for the poll. And as we can see in the last poll, I think the most driven management, and we have not probably discussed much around that. So we'll surely ask the panelists to think about around that aspect also. But as I can see through various questions that that audience has posted, and also to certain way we have also listed down. One of the key aspect that we see always a big amount of debate or discussion is while supplying safe water to all communities, be it disadvantaged or rich side of the city, whether to follow the route of centralized water versus decentralized water versus a hybrid model. And there are pros and cons in each sort of a model. I would like to hear from the panelists here that what do you think should be the road we should think about. Just to give you an example, the recently launched Jal Jeevan Mission Urban, which is a government of India mission to supply water to every household in an urban context, which has a budgetary overlay of $40 billion, talks about quite a lot around decentralization through wastewater management, lake rejuvenation, all such sort of thing for the first time in an Indian context. But yeah, with this context, I would like to hear from the panelists, what do you think should be a way forward, even for governments to think really seriously, a centralized versus decentralized versus hybrid model? And do you think there is a scope of aggregation of decentralized model to provide a better solution? So any one of the panelists or any one of you could answer around this would be really great.
So Samratji, I think a decentralized model, as far as a public administrator is concerned, I think I would always recommend decentralization, because I mean, the most important thing is that a problem needs to be sort of small enough for a community to envision what is wrong with it, and also take ownership of it. So if it's happening in if the water supply is decentralized, and that maybe a couple of thousand people can take charge of their own water supply, then what happens is that anything goes wrong, they know what is wrong with it, and they take very strong sort of ownership of it. Of course, there are some parts of it which are not very easy to manage, particularly the finance, because the moment you decentralize it, political interests become such that people stop paying bills, etc. But if we could find a model which is somewhere in between, I think that would be perfect.
Thanks, Abhijit ji. I would like to ask Victoria here, because Victoria, I could see you from your presentation, you have really talked about a piped water supply, which is sort of a centralized model. Yeah. So
yeah, no, I actually wanted to answer the question too. So, one of the cities that we looked at was Cochabamba, and they had privatized their water. It's like, very super dramatic international example. And then, there was the water wars, and they went back to a system where about half the city gets publicly supplied, municipally treated piped water. And the other half of the city has this very kind of inspired community-based model. But when you look at the city now, you don't see that either of these systems are actually one isn't doing better than the other. And so I think, and this also goes, I was reading the question to me in the question answer that one of the participants wrote. And so let me try to answer both of these questions with my answer. Decentralization is a very complicated thing. How decentralized? Imagine a city like Jakarta where everyone's managing their water at the community scale, or a city like Mumbai. You can get a real patchwork of uneven access and quality and management. It's decentralization in some ways doesn't solve problems, it multiplies problems. And so it's very difficult. So yes, there probably needs to be some level of decentralization, but let me say, and I didn't get to say this in my presentation, when I'm advocating for extending a piped water network, I'm thinking about highly dense urban environments where people are living in an urban built environment. So I'm not talking about peri-urban context where maybe there's multiple supplies of water and things like this, where things are kind of semi-rural. I'm talking about, where people are totally embedded in the cash economy and you have surrounded by impervious surfaces. They're living in totally urban, dense urban environments. For them, I think these alternative sources are very difficult, a high density urban environment. So I'm trying to answer both. So I think you actually need in those environments for the public sector to step up, and you may have involvement of the private sector for either contracting or building the infrastructure or maybe even aspects of delivery, but it needs to be regulated by a public sector, quite honestly.
Thanks, Victoria. I have a very related question. I mean, yes, I mean, there are voices around decentralization from the context of climate resilient infrastructure, because decentralized do provide some sort of a climate resiliency. However, a lot of time decentralized are super expensive, and then the question comes around the affordability. I would like to go to Vishwanath sir. I mean, what do you think from an affordable decentralized solution versus really a centralized piped solution? What should be your thought process around that?
Well, I was a strong proponent of decentralization for quite some time, but I'm changing my mind right now. It's not centralized versus decentralized now. It's centralized and decentralized. So if you take the city of Bangalore, piped water supply is coming in 1,450 million liters, but there are 400,000 bore wells providing 500 to 600 million liters, right? Both will coexist. Now, it's not being formally managed in a decentralized fashion, but it's supplementing the requirement of the piped water supply. I think this kind of messiness will continue for some time. The other example comes from wastewater treatment plants. There was a big drive in the city to demand that a set of 20 flats should have their own decentralized wastewater treatment plant, right? Chaos. Now, the association does not have the capability to run the wastewater treatment plant. The technical know-how is not there. It's in your backyard. It's smelling. If it doesn't function for a day, you're a community health risk. And there are 6,000 of them. And when COVID came, you could imagine when the media started to say that there's SARS-CoV-2 virus found in wastewater treatment plants, and you have 6,000 decentralized wastewater treatment plants. It's a regulatory management nightmare. So I think the decentralization hype has been taken a bit too strong by, let's say, a bit of a romanticism, which is being seen in the FSTP method, the fecal sludge transport method. Kariuki made this case for Sanergy. There are others who are talking about fecal sludge transport. But hey, we are replacing water with diesel. We're using diesel-bound trucks to take the sludge from the pit toilet and septic tanks to centralized FSTPs, right? And we think that we've achieved the salvation. Now, there is something critically wrong with our approaches, and I think we have to be a bit balanced. I would suggest that centralized is much more resilient than decentralized.
Thanks, Vishwanath sir. Kariuki, would you like to react to this?
Yeah, there is no solution that won't have the downside, unfortunately. So I think it's always good to look at the bigger picture and see the immediate problem at hand. So the small businesses won't be the solution to serve 5 million, 10 million people. But hey, we need people to access good sanitation. So in that case, you need to ask yourself, what do you provide them with first? I mean, we have millions of sewers, billions of dollars sunk in trunk sewers that people can't connect. So what are we going to do? Are we going to wait for 50 years for people to throw feces in the street or something like that? So we must do what we can during our time. But of course, I agree with Vishwanath that it's almost impossible to manage decentralized systems. It's very difficult. So we must look at the system, because again, at times, it's not about the sources of water, how much you're producing, or the money we have to build and whatever, we must look at the system because the system that is broken. So I think all of us agree that we need to look at the bigger picture and try and fix the system as we go along. We won't solve all the problems, but here we are, and we can pass to the next generation when we've done better.
Thanks, Kariuki. I mean, so I take the message that while at a immediate term, probably some sort of a decentralization gives immediate benefits to the users, but at a long term, we should really think of a centralized or a systems approach to provide the services, right? Right. Question to Rajesh, actually, and this question also came up in the Q&A, that while we do talk about the community level participation, but there is really a gap how government recognize the community level participation in their overall service provisioning. So do you have any suggestions for the government that that the community level the CBOs that are working at a community level, how to sort of bring them in the overall equation of a citywide water service provisioning? I mean, any sort of thought process around that?
Sorry. Yeah, somewhat. So, so we've had quite a bit of introspection, about the model that we are propagating on community managed water supply, right? And and the community based organizations that we are creating, it seems to be more powerful when they're actually outside the system. And we've thought of ways of trying to integrate them into some form of formal governance, decentralized governance mechanisms in the ward sabhas, or whatever way that they can get into formal governance systems. But we find that staying out of that seems to actually provide them the kind of the power of voice, so that they are actually heard by government, and their problems are addressed. So this is something that is a larger question that even we don't have an answer to, but we find that these systems will continue to coexist. You might want to have organizations like this, which actually keep asking the government keep demanding the government to do the right thing, and then government cannot ignore them. And then I just came from a meeting this morning, and then there was a formal acknowledgement from the Hyderabad Metro Water Board that these institutions have really helped them improve their efficiency in terms of water supply delivery. So this is really a difficult question to answer, but I think decentralization and community participation, even in a non-formal governance mechanism, has a role in water supply.
Thanks, Rajesh. Keeping in mind that time, I have probably the last question to everyone. The last question to start with, Abhijit ji. The question is that people do think that there has been now equilibrium has been set up, that we discuss, there is a day-to-day way to go. We acknowledge the problem, but we still move on. And people do think that there has to be some sort of a disruptive process come in to sort of the scenario. What do you think? What sort of disruptive process do you think need to come in? And do you think the current government are good enough to bring in that sort of a disruption?
So I think the idea that one disruption or a few disruptions is actually going to solve anything in the public sphere is far too romantic. I mean, I think it's not about a few disruptions, but it's about all of them. And like Vishwanath ji mentioned his framework, I think that that was very, very precise, because from community engagement to legal empowerment to like the right to water and actually being able to sue people and corporations and private bodies for not providing water, to very, very sophisticated schemes of finance, to models which mix centralization and decentralization, as we talked about. I think it's all of it is going to be it's going to be incremental as far as my experience is concerned. So yeah, that's what I think.
Thank you, Abhijit. Vishwanath sir, a question to you. There is a question around the basin connected cities, and while we do talk about the city level challenges and issues, a lot of dependence on the how the watershed or catchment level things do influence the city level water supply. And do you think that the current utilities have the capacity or knowledge to deal with such a basin level challenges, and are there any sort of opportunity to act on in the near future?
No, the current institutions don't have the capacity. We'll have to reimagine a river basin institution. But the current narrative has been that urban areas are somehow taking away the waters belonging to rural areas, and that these waters are not rightfully theirs, they are wasteful, and that they are a burden on the basin, on the river basin. Whereas one argues, like if we take the example of Bangalore, with just about 7% of Karnataka's allocation of water in the Kaveri River, the city supports 50% of the population. And not only does it not just consume that 7% of the water, but it returns 80% of it as treated wastewater for agriculturists to benefit, right? So the city is just a pass-through for water. And it actually becomes a water tower and a nutrition tower to the hinterland. These are the kind of narratives we have to drive, where we take away the villainization, but we understand what's happening at a basin level. Who are the major consumers? Where is the slack available? Where are efficiency possibilities available? Where is the right to water that can be notified, right? So that calls for re-architecting new institutions, which are river basin institutions.
Thank you, Vishwanath sir. Question straight to Kariuki and Rajesh, and please do take your 30-second or 1 minute time. So we can see that this supply, water resource, supply, and then disposal. Now, while we talk about water access as a more like a water supply and resource, but really we don't interlink the disposal, the water quality related challenges, and how a safe water can be supplied to the citizen. So your quick thoughts around that interlinks of resource supply and disposal and the water quality that we supply. Kariuki and Rajesh, to both of you.
Go ahead, Kariuki.
Well, I think for me, I always think about the most important thing, and the conversation we're having right now is about inclusive services, whether it's water supply or sanitation. What does that mean? It means looking at the bigger picture, making sure that everybody is considered, making sure that we are using appropriate technology, making sure that we have sustainability embedded in terms of resource, and also looking at financing and institutions. So I think it's about us starting to stop seeing things in bits and pieces, responding to access, responding to pollution, responding to catchment degradation, dealing with water demand and that kind of a thing, and starting to think in a systems context. And one of the places to begin is our planning. And I think that is where we all lost it, where we start to look at things from a bigger picture and from a futuristic perspective. That's all I can say.
So I'll take the second part on wastewater management first, because we really also believe that wastewater management is integral and very much part of the closing the loop. So when we provide water and wherever we provide hardware, there is we do provide small structures that actually act as soak pits at very minimal cost. And this one may argue whether this is scientific, etc. But fact is that it is able to do two things. One is it can recharge shallow aquifers where there is possibility to do so. Victoria mentioned that we are highly concretized, so there's very little room for water to seep in. But in that scenario, when it doesn't recharge shallow aquifers, then what it does is that it is able to prevent unsanitary conditions that emerge in a slum where people are living in very congested environments. So grey water management therefore has its advantages, and we value that and we integrate that into our solutions. In terms of water supply and water quality, I think this is where a combination of this discussion on centralized versus decentralized helps, because if we are able to monitor water quality at the delivery level, and if we are able to flag this, and then we are able to send this message across, then there are ways in which this can be addressed in a centralized water system. Otherwise, we find that with no one reporting on water quality issues, it's just assumed that water quality is fine, and that everything's hunky-dory. So, and this is where I think, again, I would go back to the point of how water quality is a significant part, a plus, especially when you want to have decentralized. I mean, it's the other way. Decentralization will be a plus if you want to address water quality issues.
Thank you, Rajesh. Victoria, last question to you. You have mentioned about MDGs and SDGs. Do you think that cities are capable to measure SDG advances or SDG reporting around water and sanitation? I can tell you that it's not so well measured in Indian cities. So what your experience from your global cities, and how cities should rethink around measuring against some of the SDG indicators when coming to the water and sanitation?
Yeah, no, it's a good question. I think you can do data collection and you can do measurement in a lot of different ways. I mean, that is actually something that I think you could decentralize. So you see, for example, Slum Dwellers International doing the Know Your City campaign and having residents and informal settlements monitoring these issues. How many hours a day, reporting on issues of water quality, reporting on basic health outcomes. So we definitely have the capacity, and actually that's a place where I think also technology, with cell phones and things, people can immediately report different kinds of outcomes, that those systems can be expanded and improved. I just want to say one last thing kind of as my final comment. I think, with all questions of capacity, it's behind that is that political will and getting those coalitions of the right stakeholders together and committing to it and thinking about it as, a human right, a community right, a social good. And I think when you have that political will, a lot more is available. In my lifetime, I've seen entire countries provide universal access to primary education where before it didn't exist, provide health and family planning to women of childbearing years. We just need to think about the importance of clean, healthy, reliable, affordable water and sanitation in that way. And when you start to think about it in that way, then I think, honestly, optimistically, anything's possible.
Thanks, Victoria. That's all from panel discussion standpoint. I'm just, I wonder if, Ani, if you are still there and listening to us, if you have any last comment to share before we close the session.
Thank you very much, Samrat. I thought that was a fascinating discussion. You have gathered a really fantastic group of people. I just want to leave with as listening to you what Victoria ended up saying of political will, but that we need political will, but we also need the solutions and the examples we heard from all of you. I think the question that you discussed between pipe water, centralized, decentralized, it's a very important question, simply because we don't have decentralized system because we could afford pipe water. If any city could afford pipe water to everyone 24 hours a day, they would do that. It's not they're making a choice, because these decentralized systems have come because we were trying to find alternative that is more affordable, more localized, more things like that. I just want to point out Victoria's initial presentation that when she did detailed research on the ground of what is the outcome was not only people don't have enough water, but a lot of the water is not usable, not drinkable, it's polluted, and there's an associated health cost with it. And that's what I thought Abhijit's point about how so many people actually use RO, I think, to means reverse osmosis, I think, which is treating and spending money doing that. that how every family that he knows is doing that. So I think we have to think about the outcome, not just whether it's decentralized, centralized, whether people are getting enough clean water. And that is the central point I think Victoria is making. I agree with actually all that we really need a system solution. Ultimately, I think Vishwanath was fantastic in articulating how we need a system, which means quantity of water that's available to cities, how it's available to cities, how does it get decided, and then how does it get distributed in cities in a way that is affordable and that is just, and that requires institutions that we need to keep improving and building. So Samrat, this was a fantastic start, I think, of what I think you're trying to do is to build a coalition of all these actors so that we can have a real conversation of how do we change the system from every angle of it, not in just one side. Thank you, Samrat, for including me.
Thank you, Ani. With that, I would like to hand over to Sindhuja for closing the session. Sindhuja, over to you.
Thank you so much for such a great discussion and overall presentations. So with this, we shall close the webinar, and within a week or so, we will be uploading a post-session summary brief. It will be up on our website, so please do watch our space. And we will also be updating a lot of information of our upcoming webinars, so have a look out for that. I would like to really thank you each, all of you, Victoria, Rajesh, Karaoke, Vishwanath sir, Abhijit sir, Samrat, and especially Ani from DC. It's been a great session. Thank you so much for joining, and hope to see you all soon.
Thank you. Thank you.
Thank you.
Thank you.
Bye.
Bye, everyone.